Hello, everybody. My name is Dominic Garbo Montoya, and today we're looking at the diagnostic accuracies of functional and dynamic ultrasounds as it relates to ACL tears. Um, this is actually a very interesting topic because I did tear my ACL, not once but twice. I tore it my eighth grade year playing football, and then I did tear it again my first year of college playing basketball. A lot of the studies and information that we went over were not options that were offered to me, so I really enjoyed this reading. Right. So for starters, what exactly are we looking at? Right. So study one, again, we're looking at functional ultrasounds versus MRI imaging, while study two looked at the dynamic ultrasounds versus the arthroscopic findings. So as we look at study one overview and methodologies, again, study one was functional versus MRI. And it's important to realize that this was actually a prospective trial, which involved 130 patients who were suspected of an ACL injury, right? And the researchers used functional ultrasounds to measure tibial translations. Essentially what this is they were looking at the forward movement of the shin bone relative to the thigh bone. They took these measurements and they looked at the good leg versus the injured leg. And when they did their calculations, if the measurement was actually greater than 1 millimeter, then it was considered significant, meaning that the individual in the study essentially had something going on with their ACL. All right, and then study two, right, overview and methodologies. Again, this was the dynamic ultrasound versus arthroscopic surgeries. Study two was actually a retrospective approach, and they used analyzing data from 247 patients. These patients had already undergone both dynamic ultrasound imaging and arthroscopic surgeries. The goal with this study was to evaluate how well dynamic ultrasounds could differentiate between both partial and complete ACL tears. And then they used that and compared the data from the ultrasound to what they actually saw during the arthroscopic surgeries. All right, and then I wanted to put up a slide that kind of showed a comparison between the two methodologies itself. I thought it was important to add prospective studies and retrospective study, just as far as its definition. So the prospective study is actually defined as a study method that follows a group of people over an extended period of time and determine how the factors and exposures relate to certain outcomes. While the retrospective study is a research method that analyzes past events and data to understand the relationship between the exposures and the outcomes. And then they obviously use these existing records and data to collect information before the study design. So again, both studies used ultrasound to diagnose ACL injuries, but their approaches were slightly different. Again, study one was prospective and focused on quantifying knee movement and motions while using MRI as the reference. And then study two was, again, the retrospective study that took visual assessments of the ligaments and its integrity overall, using the ultrasound and then comparing those findings to what they actually seen. It's also important to understand that study one aimed to validate ultrasound as an alternative to MRI, while study two was used to assess its ability to distinguish the severity of the injuries. And this is actually something particularly useful for surgical decision making overall. All right, so what were some of the results? So for study one, the study one reported a sensitivity of 81.6% and a specificity of 89% for functional ultrasounds, with a very high positive predictive value, as you can see, it being 97.8%, What this means is when the test said that the ACL was torn, it was almost always right based on those values. And then when we look at study two, right, study two found that dynamic ultrasound correctly identified 88% of ACL tears. Unfortunately, it was much better at detecting complete tears than partial tears. And those partial tears were determined by its 52% sensitivity compared to the 79% for complete tears. So with this, dynamic ultrasound is effective for complete tears, yet less effective for partial. And then what are some practical implications of the study, right? So what does this mean overall for clinicians? Ultrasounds, whether functional or dynamic, offer a faster, more accessible diagnostic tool, especially useful in emergency settings in rural areas or clinics with limited imaging access. As we can remember from some of the past studies, right, MRIs are extremely expensive. And so if we have a tool like ultrasound, which is a lot more cost effective, we can kind of mitigate some of those costs and save patients money by having a tool that allows the diagnostic, or at least leading us to a better diagnostic before we jump right into something so expensive. Again, some of the limitations is just they both really struggle with those partial tear detections. And then both methods, they just really can't fully replace the MR or the arthroscopic surgery. So that's why it's better used as at least an initial tool to kind of guide physicians to better diagnostic understandings. So in conclusion, ultrasound is a viable tool, as I mentioned, in ACL injury diagnostic, but again, the choice between functional and dynamic approaches depends on the clinical context, right? So we want to look at clinical context and overall available resources. As you can see in the slide, it mentions functional ultrasounds are better for measuring joint motion, while dynamic is just much better for visualizing the tear altogether. But if you can combine the usage of ultrasound technology and then use that to guide or determine whether or not an MRI is needed, then you can further use MRI and arthroscopic surgeries as diagnosed between each patient. But with that, again, I like I mentioned earlier, I was really interested in this topic, especially because I have torn my ACL. So it was really interesting finding out some of the newer technology that can be quite beneficial to many different individuals in many different situations. Again, thank you guys for watching my video, and I really hope that the comparisons that I've made throughout this provided some useful insights. You guys all have a great day, and I just wanted to finish up the slide with some of the references that I used.